It is time to kick off this day with our first speaker. Johanna Wollert Melin is the founder and CEO of Trice Imaging Europe. Trice Imaging is a cloud solution for medical imaging with customers in 43 countries. Johanna has 12 years of experience of selling SaaS solutions to healthcare providers around the globe. Today, she will share her learnings from scaling globally. Johanna, the screen is yours.
Thank you so much. What an exciting topic, B2B sales. I will take you through what Tricify, our platform, does and where we are today and what we learned during the baby years and what we learned the last couple of years when we've been scaling our company. So Trice mission is, our mission is to provide quality of care for people regardless of who and where they are. Today, 1/3 of the global population doesn't have access to imaging tools. It's a vital tool to diagnose cancer, heart disease, stroke, respiratory infection, and pulmonary diseases. So we provide hospitals and clinics a cloud-based medical imaging solution where they can archive their data, where they can document their medical imaging exam, where they can share their data to a doctor somewhere in the world that could do a second opinion, and they can also share securely to patients. We have today around 1,500 hospitals and clinics as customers in 42 countries. And the 5 use cases that they use Tricify for is to upload and archive their medical imaging exams. That could be an ultrasound, an MRI, or a CT study. To access the data from wherever you are, as long as you have a web browser, to document your imaging exams and to share the data to a patient or for another doctor, and to do big research projects around the world. So today, we're almost 10 months into 2020, and we've done 2.2 million patient shares this year. We have around 17,000 Tricify users. We have uploaded 2.7 million studies this year, and we have around 3,000 medical imaging devices connected to Trice. You could think that that number is a low number, but we are actually the biggest cloud solution in ultrasound globally. We have most imaging devices connected. We handle around 1 terabyte of data per day, and we're available in 42 countries. So we our classical SaaS solution with the evergreen subscription, meaning you sign up for a year, and if you don't quit the service 30 days before that year, the next year will roll over. And you buy Tricify in packages per machine or per transaction. And we have different type of packages. Either you use our basic service that is only to replace USBs, thermal printouts, to share data directly from the imaging devices to a doctor or for a patient. Our second package is that you archive the data, and our third package is that you could do the documentation. And then, of course, we have different prices for different type of packages, a classical SaaS business model. Our average price per study is around $1, and things that are super important for us when it comes to our sales funnel is to understand our conversion rate. So when we receive a lead from our web page or from any of our activities, it's a turnover of 63%. If our customer gets up on a trial, we do have a 30-day free trial to try out the service. We have a 96% conversion rate. Another number that is extremely important for us to focus on is churn, meaning how many customers that leaves us every year, and it's under 2%. And I would say this for a SaaS solution or B2B company shouldn't be above 5%. That's a good churn. You could see some of our customers here. We are so proud with that. We have Johns Hopkins, we have Mount Sinai in the US, we have Akademiska, Karolinska, Lund University, Sahlgrenska, Aleris, Capio in Sweden. Those are probably names that you know about. But we do, our biggest market is the North America market. And when it comes to women's health, we have around 800 clinics in the US. So we have a simple business plan. First, we want to replace USBs and thermal papers. A lot of these imaging devices around the world are not connecting to PAC system, only 20%. And we do want to make sure that small and medium sales, we want to automate them as much as possible. So when you receive a new device that has Tricify that is embedded, you should only be able to put in an email, and then it's an automated process to onboard you to the Tricify solution. So normal practice today actually get up and running on Tricify. For example, like Sahlgrenska that I connected maybe 5 months ago, they have around 12 machines and they were up and running on the Tricify solution and trained within an hour. And of course, the next big play for us is data. One thing that is so when it comes to our channel strategies, our motto is to be able to be embedded in these type of imaging devices. These are our sales channel. Philips, Samsung, GE. With GE, we're actually embedded in all of their imaging devices when it comes to ultrasound and all of their segments when it comes to imaging. And we are also embedded in Sonosite, and a couple of more medical device partners are coming out the upcoming year. But we also work with distributors, close with distributors. Distributors, they're mostly distributors for the medical device manufacturers and for EMR solutions globally. And we also, for smaller and medium-sized practices, sell online. So this is what we kind of done. This is our global distribution network. This is what we've done the last 12 years. But what are our learnings during these years? So key learnings is building our sales during the baby years before our product were established. I would say don't assume it works in one country or one imaging segment. It will work anywhere. Make sure you do your homework to understand the customer's problems and needs in every market segment before you launch. Don't settle on one partner. Don't do exclusive agreements. This can be extremely dangerous for a startup. I've seen a lot of startups during my years going bankrupt because they did exclusive agreement with bigger partners. Hire people that knows the market, that has the Rolodex, knows the industry and the culture in every country. Extremely important. Otherwise, it will take a longer time for your founding team to get up and running on that market. Do leaderships and trials is a very good way to teach the market what your product could do for that industry. Make sure you have key opinion leaders. There are luminaries in your segment that can vouch for you, can open doors, that can help you develop your product. And if you want to work through distributors, you first need to have your own sales team and support team in place before you work with distributors. Because working with distributor, you have to have a task team with different type of people in your team that works closely, that follow up the distributors weekly. And in the beginning, don't spread your management and sales team too thin. No is a good way to success. And adjust your product. This has been very important for us when it comes to reimbursement. In some type of industry, you will get money from the government if you have different type of features. That could be a good way to scale. So what the learnings during scaling our business the last 4 years. It's all about structure and automations to scale fast. You have to have one global sales process for the company and for distributors. You have to have KPIs for every stage on the sales funnel. You have to have clear KPIs per salesperson, goals, how many leads, how many outreach activities they need to do to partners, to customers, how many upsells they need to do on their customer base, leads in new segments, etc. You should have a close collaboration with the marketing team to build awareness in social media with partner channels and email campaigns. You have to be able to adjust your offering and pricing after each market. You can't have the same prices in India as you have in the US. It will not work. One thing that we've done the last 2 years is to establish an academy. So we have an academy that do webinars, they do trainings, they have user guidance, they have marketing material, they have sales material, they have user stories for distributors. So all of our partners and distributors and even our sales team have the right tools in place to do a good job. We also communicate weekly with our customer base in every part of the sales funnel. How we communicate with leads, how we communicate with trials, how we communicate with customer, and don't forget, even communicate with terminated customers. Make sure you follow your competition position closely, so you know the pricing in every market, so you know how to position your product against your competitors. And what we've been working with the last couple or 2 years is a sales strategy for different types of deals, meaning small and medium deals. We're trying to streamline and automate them as much. And when it comes to mega deals, we will have a task team and more solution selling and change management. And something that is important when you're doing these kind of mega deals or bigger deals is that you make sure you have a CEO and a CFO offering to organizations. So I actually put a link here, Ronja, for our academy. If people want to, it's actually official. So you can go to this. It's a public site where you can see our academy, how we've been building up our academy to training both our customers, partners, and distributors, and actually even our team. That was it. Thank you for having me.
Thank you so much, Johanna, for sharing your insights with us. This is really exciting stuff.